Hello everyone, I'm Dr. Rohan Khandelwal, your Marrow SS General Surgery faculty, and it gives me immense pleasure to introduce Dr. Ayushman to all of you. He secured rank 2 in the recently conducted NEET SS exam, and what makes this interview even more special for me is that he is uh, finally a postgraduate from Safdarjung Hospital, a place where I did my MS from, and his guide was my mentor as well. So that's what makes it even more special. Heartiest congratulations, Ayushman. How is it feeling?
So it is unbelievable. First of all, thank you, sir, for the congratulations. And sir, it is unbelievable. Like I can't express my words in. I think, sir, because I was not expecting this much rank, sir. I was just okay. It will like in 100. I will get a rank in 100 only, or I will prepare for next year. It will give me a experience, just an experience, but I don't know how it came because this year the paper was also
I'm sure it's come because of your hard work.
yes, sir. Maybe.
But you were saying, I'm sorry I interrupted you. You were saying your analysis of the paper, please.
Yes, sir. It was like last year. It was like I saw last year's paper. It was much from books also like Bailey and Seviston. But this year it was from not from directly from the books. The questions are more confusing and the lines are not from directly from the books. They are more clinical based questions was there, sir, and the options was very close. So it was difficult to choose between two. In even 40-50 questions, it was very difficult to choose between two, sir.
Yeah, I agree. I think so. The options this time were confusing, and that's what we've also gathered from most of us, most of the students. So you're
So,
right on that front. So Ayushman, you've been a Marrow student since the last year and a half. How has the journey been with the Marrow SS plan?
so it was it was good, sir. It was I just first of all because I was using this Marrow in UG also, and I'm huge
Mm,
fan of yours, sir.
thank
I know before I came to Sabdajang, I know you that it's good. So it was my first thought that I should use Marrow for my SS preparation also. So I started Marrow, uh, uh, and sir, I just started using. First, I started seeing your videos on general surgery, sir. Then some videos on gastrosurgery from Dr. Prashant and Dr. Venkatesh and Dr. Samrat. So for my GI surgery preparation also along with the general surgery, sir. So it was helpful, sir. And I used, sir, I did some questions also from Marrow SS question bank, sir. It was also good. And after that, sir, I that along with that, sir, I majorly I read books only like Bailey and Sebiston, and along when I have some difficulty in like understanding any topic, then I refer to you some videos of you which are very concise and very good. So I use that also. So this is how my journey with the Marrow.
So, I, Ayushman, you are still a final year student, okay? Final year surgery PG. I want to know how did you approach the books? So that would be beneficial for other students as well. So, तुमने कहा Bailey and Sebastian you were reading. कैसे पढ़ रहे थे?
Yes.
What are the tips which you would like to give to other postgraduates regarding how to read those books?
Sir, I think you should read Bailey, sir. Sebastian is must, sir, because this year, sir, the Bailey is new edition of Bailey also came, sir. So we were confused also about it.
Mhm.
The paper is coming from 27th edition or 28th edition, because there was one question which was from 27th edition of Bailey. So everyone told me from last year's paper. Actually, my seniors or every sir last year's interviews they told that paper came from Bailey and Sebiston only, and majorly they were telling that Bailey. Some people are told me that it is come from Bailey only, or some people are told that it is from Sebiston. So I used to study both, sir. General sir, the general surgery part of the NEET SS, sir, I used to study from Bailey only, And then the super specialty part used to I studied from Sebastian sir, like plastic surgery is it is in better, and the GI surgery is only sir Sebastian only, because Bailey this year they added some good points and good topics in the Bailey, but last year the 27th edition doesn't have that much knowledge on GI surgery, sir. So GI surgery basically I used Sebastian only, sir. And
So,
sir,
but I feel this year there were a lot of questions which are asked from the Bailey updates, the points which are updated in Bailey in the 28th edition. At least I feel 15 odd questions were asked from those updates only in the SS exam.
yes, sir. The actually when I compared it uh, during I was preparing and I was comparing the NEET Bailey updates with the Sebastian, sir. Some of the points are already in the Sebastian that time, so
Correct.
it is.
Correct.
That's why it is from Sebastian. I can say that paper was from Sebastian also. Otherwise, sir, the NEET
So,
SS, the Bailey updates are helpful, sir. That was very helpful, and we were sure that some question will come from Bailey update only. And
so I
sir,
think so. Your strategy was very simple to read the general portion from Bailey and
yes,
the specialty part from Sebastian. Did you also utilize some other book like Schwartz as well for selected topics?
yes, sir. I use. I forgot, sir, to mention sir, thyroid and the breast. It is very good in Schwartz, sir, because in I initial sir, from second year I started, because my unit is breast and endocrine unit, so I want to study breast and endocrine in detail, sir. So I started first from Schwartz, sir, because everyone told the Schwartz is better than other two books. So breast and endocrine just I read from this Schwartz, sir. So that was helpful. And sir, this year
You
paper
said that you were doing questions and tests also from Marrow. Did you appear for the mock tests and for the grand test which we had planned before the exam?
sir, I yes, I had given sir 3-4 tests, sir, and mock test I also had given sir 2, I think. So that
What was
was
your
very
rank in the
helpful.
mock test?
It was not good, sir. Um, but that is actually good, but because Mero is a different platform and other are different platforms, so it can it will give so it should not give you the false confidence that you are doing good. So if other platform I'm doing good and I came to Mero, then my rank was not good, so I was that key, the my preparation is not up to date, I have to study more and hard work more. So it was like that. So Mero's test was very good, sir, in that case.
Right. So,
Yes, sir.
how important is it to work during PG, and how much did your work at Safdarjung help you in the questions?
Yes, sir. Because my guide is, Chintamani sir is sir. He used to teach all the time. So it was the work is hectic, as you know, in Safdarjung Hospital. It is very hectic. Along with because the my our rounds are 4 hours, 5 hours rounds were in like
I know that.
so. I sir. So that was helpful. Sir also teaches us, and so that gives us that.
But I think so that is beneficial because as sir takes such lengthy rounds that a lot of these questions get covered up there only, right? A lot of values, a
Yes,
lot of
sir.
things sir covers up in his rounds. So I feel attending those rounds and having that is an additional benefit over
Yes, sir.
reading textbooks as well.
Yes, definitely, sir. That is also it is a bit of enjoyment. Like you are along with the patient is in front of you, and you are discussing questions, answers, and sir also like sometimes very funny, and sir the way of asking questions and giving answer is different. So that was very good of
True.
Chintamani sir. And he used to ask like you, Rohan was standing there, and all the time he talks about you, sir. You were the ideal student of his.
No, no, I think so. There's a special bond which we share, but I mean, I've also taken a lot of inspiration from his way of teaching. So, Ayushman, coming back, few questions which postgraduates ask me: when should one start preparing for the SS exam?
I think, sir, third year starting, and we should on the start of third year we should start preparation. Before that, sir, you are too busy, or you can start from mid of the second year, sir. Because after that, your first year is also accommodated, and you are also a bit of accommodated with that time, sir. So after that, you can start your preparation. Like you can study, and some you can see patients and you study along with that, so that correlation will be helpful. uh, and sir, majorly, sir, I studied in third year only when my super specialty posting started, sir. That is enough. I think 6 months to 8 months are enough if you study properly, and you study books. And books is important, I think, along with the videos. If you don't have much time, you should watch all the videos, sir. The Marrow, if you are preparing for the NICET, then you should use Marrow videos, gastrointro videos, sir. Gastro surgery videos I saw, it was very helpful, sir. Then I used to realize that I should watch these videos before I started preparing, because after that, I before because of book I had some confusions which was cleared after I started watching the videos of Dr. Samrat and Dr. Prashant in sir GI surgery videos, sir. So it
So
was.
I think so. You're absolutely right that the first year and a half, one should focus on learning the skills and learning how to do the ward work, to learn surgical skills, and they should not be
Yes,
focusing too much on the theory part. I mean, of course, some bit of it is important, but the actual preparation for SS should, as you rightly mentioned, towards the end of second year and starting of third year, and 8 months, 6 to 8 months is good enough. Um,
yes, sir.
how would you say that the approach for somebody who's a first year, second year watching this video, they are confused whether to go for NEET SS or for INA SS? And what I've usually seen is that final years postgraduates and those who've just passed out, they tend to do better in NEET SS because they have a better holistic knowledge and a better theory knowledge as compared to somebody who's 1 year or 2 year pass out. They are preparing for one specific branch, so, they have more in-depth knowledge of the subspecialty rather than general. So, would you agree with this fact? And how different is INI preparation from NEET SS preparation?
Yes, sir. Sir, you are rightly said, sir. It is. I think it is easy when you are in third year to get a rank in NEET SS, sir, because you have holistic view and you just had given your third year exam, sir. So you had read book, like all the long questions, short questions you have done. So you have more of that idea of all the questions which are coming. So it is easy in the first year, sir. When you are in a running year, when you are in the third year, it is easy to get a rank in NEET SS, other than after 1 or 2 year of SRship, because after that you forgot some of the general surgery part, and you focused more on subspecialty part, or you focused on, like, I will give this INICET exam in this branch only, and you develop the interest that side only. So usually they get good rank in INICET, which the people who are preparing after 1 year of SRship. So I think it is better if you give in the third year, or just 1 year after that, not after that, because that it then it will become more difficult. Year by year, it will become more difficult for you to get a rank in NEET SS. And sir, in NICET, sir, some of my colleagues who were preparing for me along with that, sir, they started this NICET preparation in second year itself, and for whole 1 year of second year, and then third year they read the whole this general surgery part, sir. So they, along with the third year, they have cleared this INICET. I think if you are preparing for one subspecialty, then you should start early, and you watch Marrow videos of Marrow video, and you can read book You should have that much time that you can read this if you are preparing for Euro or GI surgery. So there are heavy books, I think, because you have to read. If you can't read all the 3 books, which are like for GI surgery, you want different books, and for Euro surgery, you have different book, and Bailey and Sebastian, you can't read all the 3 books in 1 year or third year. So if you're preparing for NICT, you should start early in second year, I think, and
So,
complete it.
Ayushman, let's talk very simple facts so that it is easier for other students to follow as well. Along with the videos, I will keep on taking subspecialty name. You keep on telling me कौन सी book से उसका तैयारी की आपने, ठीक है? आपने कहा general surgery you did mainly from Bailey plus some bit from Sebastian along with the videos.
Yes, sir. I just read the tables of general, sir, from the Sebastian, sir.
Okay, fine.
General surgery tables only.
For GI, you predominantly did Sebastian.
Yes, sir. Yes, I prefer Sebastian only.
Breast and endocrine, you did Schwartz.
Yes, sir. Schwartz, and after that, I some bit of Sebastian, mainly Schwartz.
Right, fine.
Yes.
Then urology.
Urology from sir only Bailey, sir. Bailey is
Only
enough,
Bailey.
I think. Yes, sir.
For NEET SS, only Bailey is enough.
It is enough for
right. Pediatric surgery.
Sir, it is from Sebastian. Sebastian, it is extensively covered in Sebastian. Yes.
Extensively covered. Plus, there's one that extra chapter on fetal surgery from which questions are also being asked.
Added. Yes. Sir.
Yeah, correct.
It is added this time. So plastics.
Vascular.
Yes, sir. Vascular surgery, sir. Last year, there was more questions from the CTVS, sir. It was they asked like 33 questions asked from CTVS. This year, sir,
and a lot of questions from pediatric CTVS also last year.
Yes, sir. Pediatric CTVS also. The last time they asked every questions, which is like boot-shaped heart and everything. They asked last year only. We were very afraid of this time. Like what they are asking this time, because so you have to read Bailey. Bailey you have to read in CTVS, and then after that, you have to read that all the images and the tables in the Sebastian along with the Bailey part of CTVS. You have to thorough with that, and I think that is enough. And sir, some part of vascular surgery like vascular trauma and the vascular part only, that I have read from Sebastian along with that, sir, with the Bailey.
All right, neurosurgery.
So neurosurgery from Sebastian only, sir. Sebastian and Bailey, but mainly, sir, Sebastian is coming all the these years, sir. But because we were afraid that this year the Bailey's new edition came, so question can come from Bailey also. But usually I used to read only Sebastian only, sir.
And trauma.
So trauma is from Bailey, sir. All.
Perfect. So I think so. Dr. Ayushman has told you where to supplement the videos from, along with the videos which he saw on Marrow. These were the sources which he used for individual subspecialties. But this is only for NEET SS. Of course, for INA SS, he said that you have to go in depth of that subject and you have to read the standard textbook of that particular subject if you're preparing for the INA SS exam, where a lot more weightage is also given to that individual subspecialty. So आयुष्मान, इसके अलावा और कुछ आप टिप्स देना चाहोगे जो एसएस की तैयारी करना स्टार्ट कर रहे हैं? Any other tips which you want to share?
Yes, sir. First, you have to develop that interest in that subject which you are preparing for. You should have then an idea like you are going to prepare for 8 months or maybe 1 year serious preparation, sir. With you should be thorough with the books, sir, Sebastian and Bailey, if you are preparing for NEET SS, sir. And if you are feeling bored or you are not getting that motivation, then you should start using that start videos. And because I used to study in library all the time, so you can use library also. You can use your PG library in your hospital. So your friends and colleagues are very important, I think. if they were not there, that I can't do that much of lengthy studies, I think, because they give you competition also all the time. And yeah, they are sitting, you have to sit longer than them. So and it is give you bit, you should have bit competition in between your colleagues, I think, that time. So my colleagues are very good. They were 5 6 of they all get very good rank in this year, sir. So that is very helpful, sir. And
Great,
yes.
great.
And yes, sir.
So thank you, Dr. Ayushman. Thank you for taking out time and talking to us. I think so. We got great insights from you regarding how to prepare for the NEET SS exam, and I would like to again congratulate you once again
Thank you,
from the
sir.
entire Marrow team. All the very best, and finally tell us which subspecialty are you going to choose?
So I'm going to choose my first. Sir, I will definitely go for GI surgery, sir.
GSS. Great, great.
Yes,
So thank you very much for taking out time. बहुत बहुत बधाइयाँ, Dr. Ayushman, and
yes,
would love to meet you soon. All the best.
yes. Thank you, sir.